Hi, this is Don coming to you from www.theclinicaltrialsguru.com. It's kind of the end of the day here, and just wanted to leave a message. My partner Dan and I had went out to this room and board this afternoon to do a presentation about research, how medication is developed, as well as the study that we're working on. And talking to the house manager there, we had an interesting conversation. Now, we never really got a chance to do the presentation because there was a little miscommunication on setting this meeting up, but that's okay. We still had a chance to introduce ourselves to the house manager, and then actually a couple of clients came up and wanted to talk to us about a few things. But some interesting things came up or came out of this meeting. Once we were there, we spent a little time talking to the house manager. A few clients were kind of checking us out, but they all stayed sort of at a distance away from us. They didn't. Only a couple of them came up and engaged us just real briefly, and then backed away. The house manager, he was a little vague at first on some of the information, but the more we talked, the more comfortable he got with us. He opened up to a few more things. Now, he said that already right away a few of the clients came up to him and say, hey, are those another group of people that are coming out here making promises to us that that they're going to get us well? That's not what clinical research is about. Clinical research is not about bringing people in to give them medical treatment or to get them well. It's not set up for that. It's set up to collect data. That's what it is. It's set up to collect data to see if the medication or the treatment that you're testing is a good treatment or a good medication. If it's going to be better than the existing medication. That's what I see. He said they've had a lot of people that come knocking on their doors before, trying to get these clients to go into clinical research studies by promising them that they're going to get them well if they come out and try this medication. And that's not what it's about. That's wrong. No one should be telling you that. Now, I mean, it's great if you go into a clinical study and that medication is working better than your existing medication. I mean, that is definitely a positive, but that's not a guarantee. Some people do well in studies, and there are some people that do not do well in studies. Clinical studies aren't there to provide medical treatment. It's there to test medication or to test some sort of treatment method. It depends on what the research protocol is, but most of the ones we're doing is testing medications, and that's what takes place. So if anyone's coming out telling you that that you're going to get well by coming in their clinical study, they're lying to you. That's not what they're supposed to be. That's not the truth. That's not what takes place. Again, it's about testing medication. When you go out to these places, people should be honest with you. They should tell the truth about what's going on. They should talk to you exactly about what takes place in their study. They should let you know what the risks are and what the medication is designed to do. And the more they inform you, the better off you are making an informed decision. But they should never make promises like this medication is going to get you well, because sometimes these are new medications. They don't know if it's going to get you well. They don't know how the treatment's going to work. That's why they're conducting that study. So anyway, if someone's telling you that, hey, you come in our clinical study, you're going to get well, we're going to get you well, come on and try this medication, it's better than your existing medication, they don't know that, and they shouldn't be telling you that. Anyway, just want to leave that little note at the end of the day. And again, I thank you for watching my video and checking us out on www.theclinicaltrialsguru.com. And my name is Don, and signing off.